I'm excited to be the new chair of Health and Human Services. I know there's a lot that we have to do, and so I am. And Madam Clerk.
Commissioner Baker McCormick has requested an excuse. Commissioner Marecki has requested an excuse. Commissioner Anderson. Commissioner Colleen.
Yeah, I'm here.
Chair Scott.
Present.
You have a quorum present.
Thank you, Madam Clerk. Next item, please.
B, Chairwoman's remarks.
I have none. I think I just made a few before my time.
C, approve the December 12th, 2023 meeting minutes.
Chair.
Okay, moved by Commissioner Colleen, supported by Commissioner Anderson. And I support it. So all in favor?
Aye.
Aye. Motion carried. Next item, please.
D, unfinished business. There is none listed.
Thank you.
Moving to item 1 under new business, forwarding the report on how funds were utilized and spent from the Michigan Department of Health and Human Services Local Community Stabilization Authority for fiscal year 2022 through 2023.
Motion to approve this.
I have a question, Madam Chair.
Okay.
Thank you, Madam Chair. Well, just a couple of questions on this. What's the funding? What is the purpose of the funding from the local stabilization authority? And then you discuss that we're going to take the 22-23 funding and roll it over, the 700,000 we have. And you discuss, you're looking at one-time technologies and essential staffing, which is important. And the details will be included in the 23-24 comparison report. When do we see the 23-24 comparison report?
Dr. Saab.
Yep. First of all, good afternoon and welcome to two new members to the HHS committee. Looking forward to working together. Dr. Abdul El Sayed, I'm Director and Health Officer for Wayne County's Department of Health, Human and Veteran Services. And I know that Director Dean is also on the call on Zoom. So local stabilization funding is funding made possible actually via state statute, specifically to support essential local public health services. Those are defined services. So unlike other forms of funding, we cannot use them beyond services like food safety or vision screening, things that are mandated via public health code. In the past, what we'd done is we had used this funding as a fail-safe should we have had any budget overages at the end of the year to balance budgets. We've recognized, however, that given that this is funding that comes out of state statute and is therefore pretty consistent, you can count on it, we'd like to use that funding to make some investments moving forward in some programs. So given that this is rollover funding, given the choice not to sort of sink it into overages, considering the year we had last year, what we'd like to do is invest in one-time investments for vision and hearing in particular. We'd seen over the last year increases in other essential local public health budgets. So for example, the food safety program had an increase in its budget from the state of Michigan. Vision in hearing, however, did not, but this remains one of the programs that we can use it against. So we want to upgrade our vision and hearing screening equipment, and then we want to invest in staffing and staff augmentation so that we can better service folks. One of the big programs that we plan to launch in the coming a year, hopefully, if not the year after, will be a comprehensive vision program that goes beyond simply screening kids for vision deficits, but actually starts to address those deficits by providing access to free pairs of glasses. In order to do that, we really need to upgrade our operations, and this is an important step in that direction.
Okay, thank you for that. And
follow up to that.
Huh?
I could follow up too.
You want to follow up?
If you don't mind.
sure, I
To that
got my own follow-ups, but go for it, Commissioner.
Alright,
Okay,
Just-
Commissioner Anderson.
Thank you.
Mhm.
Doctor, I wanted to ask you, has the county, to your knowledge, ever worked in tandem with the Lions Club for glasses, or is this going to be a new direction you're going to go in?
I'm not familiar. We are actively right now building out the protocols for the program that we're hoping to solve. We're not working with the Lions Club, but of course, we're always interested in hearing about partnerships.
The reason I ask is when you talk about vision, that was when I was ninth grade in high school. A teacher recognized I needed glasses, and she had a connection with the Lions Club. They paid for the glasses, paid for my exam, and the whole 9 yards. And I'd like to see us, when that time comes, to partner with them to see, because I'm sure there's many Lions Clubs that would like to partner. Maybe the state organization might work with the county.
If you'd like to put me in touch with folks, I'd certainly be interested in a conversation. That vision that you just laid out, however, the ability to not just test children for vision deficits as is required, but be able to recognize their vision deficits and then address them is exactly what we're working to do. So, that moment for you that I'm sure was really transformational in your life, we're hoping to provide that for children across the county.
Good. Thank you.
Thank you, Commissioner Colleen.
Yeah,
You may
thank you very much.
continue.
Yeah, thank you very much, Madam Chair. Okay, so the LSA funding is proscriptive? They have a list?
It is a list of programs that they can fund, which
Yeah.
are defined as essential local public health services.
Can you share that with the commission, please?
Absolutely.
Because I see you're going through and you're kind of being strategic. I forget the word you used in here. Yeah, to have a more strategic approach, you want all the time. So I would love to see what our choices are for this. And is there going to be a similar amount of money next year?
So
Or-
this essential local public health funding is
Every year.
consistent every year.
Every
It's
year,
written in
same
state
thing.
statute.
Yeah.
The reason we're trying to, so this funding is not proscriptive in the same way that the master grant that we get from the state is
Yeah,
every year for particular programs.
Yeah,
Instead,
the
it'll
10 million or whatever.
Exactly. Instead, it allows you to choose between essential local public health services. So what we're doing is we're recognizing where the state's made investments in our programs, and then we're trying to buttress that by making investments in those programs that we're not invested in.
But I appreciate if you would send along
Sure.
what that, and then, because you mentioned staff, are we going to have any of this spending on staff that we're not going to be able to sustain?
We don't foresee that. As you all know, we're in the midst of collective bargaining with all of our unions, including the union that represents our vision and hearing specialists.
Yeah.
One of the big challenges that we've had in the past is that at the current rate, we haven't been able to hire. We're really excited about the ability to be able to do that at the rates that we are going to agree to once that is, of course, ratified by commission. And once that happens, we feel like we'll be able to staff appropriately and sustainably.
And then one last question, I may be getting ahead of it a little bit here. Is the idea that future local stabilization, LSA funding, would also go towards salaries in case we put people on now, but in the future, those LSA dollars, rather than covering up holes in the budget, will actually go to paying a frontline person to deliver these services. That's the idea?
That's exactly the transition we're making.
Thank you. Thank you, Madam Chair. And I'll move to receive and file.
Thank you. And I would just, is this a part of the union contract?
So this is separate from the union contract. The union contract, of course, is covers employees that will whose salaries will be funded in this way,
Mhm.
but that's separate from that contract, which will be coming around the pike soon, we hope.
Okay, thank you.
Mhm.
All right, you may move here.
You want to second it?
Support.
Okay, it's been moved by Commissioner Colleen and separated, supported by Commissioner Anderson. And I support it, so. All in favor?
Aye.
Aye. Thank you. Next item, please.
Item 2, requesting commission approval of Amendment 1 to the fiscal year 2024 project allocations for emerging threats, local health department grant agreement with the Michigan Department of Health and Human Services for an existing project, COVID workforce development, and to provide continued support for the American Rescue Plan Act of 2021.
All right, thank you, Madam Chair. We do have someone here to speak on it. May go ahead, please.
Hi there, Avni Sheth, Division Director for Clinical Care Services. This is our Amendment 1 with our agreement with the state that bundles in all of our kind of COVID special projects. I'm sure you guys are familiar with our comprehensive agreement, the CPBC. There's a second bundle of agreements in the last couple years that bundles all of our kind of new emerging grant-funded programs. This is a program, COVID Workforce Development, that we did receive last year as well. And this is this year's allocation of $110,000 that goes towards supporting and expanding the capacity of the Public Health Department and the workforce. And so we'll be putting this funding to good use to enhance the workforce, do some trainings, and also build out a public health data dashboard for the community.
Thank you. Is this the same amount as last year?
So we received about 300 and something thousand last year total in that entire fiscal year 23. So it is a smaller amount this year. We don't anticipate this to be a continued funding source. And so we're trying to take advantage of it this year.
All right. Thank you. Are there any questions? Commissioner Killeen?
Thank you, Madam Chair. I'm going to ask you some similar questions that you heard on the last. So this goes through September of 24. Is there any funding beyond September 30 of 24 for these purposes?
We don't think so. We haven't heard this.
These are
that could
ARPA
change.
dollars, right?
You know, it is,
No?
I don't know the exact funding source. It's coming from the state through the CDC. I don't know what the origin is, but we can kind of find that out.
Yeah, it's probably not ARPA dollars if it's coming through the CDC.
Yeah.
And that would also mean then that there is the possibility for future funding. You know, like the ARPA, you have to spend it. This is the date after that. Forget it.
Right.
Yeah.
So this is, it is CDC funds that are administered through the state and given to local health departments, but it is under kind of the COVID grant funding. So as we know that has, decreased and is coming to a stop in many areas. And so we do anticipate this is one of those ones that likely will not continue next year, but we will find out more as the year continues.
That'll depend on Congress, I'm sure, but.
Dr. Syed?
Dr. Abdul Al-Sayed, Director Health Officer. And so this is not ARPA dollars. This is CDC COVID funding that is intended on the follow-up on the back end of COVID to shore up some of the public health infrastructure that we'd seen. I will say, and I don't mean to task my dear commissioners, but I am going to share this, and y'all do with the information what you'd like. When these decisions tend to be made, the CDC will pick out certain municipalities. They will directly grant fund them. Then they will fund the state, and the state then allocates it as it chooses. Here's the challenge with the way some of these decisions have been made in the past. The municipality that tends to be chosen is the city of Detroit. Justifiably so, but the city of Detroit is about 675,000 folk, right? We, from a public health jurisdiction standpoint, cover about 1.2 million lives, nearly double the size of the community covered by the city of Detroit. When the CDC made decisions about funding, they offered the city of Detroit upwards of about $9 million. The state of Michigan got $80 million. They kept for themselves about 35 million of those dollars, or a little bit less, a little bit more than that. And then they covered the rest of the state, took the rest of the money and divided the allocation evenly. Now you see the challenge with that, right? There are 44 other public health jurisdictions in the state. We cover more than 10% of the entire state of Michigan's population. The city of Detroit ended up getting about 10 million, and we're getting a couple 100,000 over a couple years. You see the problem. So as we think about equity, and that tends to be the buzzword we talk about, right, which is equal opportunity coverage, you see the problem with equity there is that the residents of Outwayne County, communities like Highland Park, right, communities like Hamtramck, communities like Dearborn, communities like Westland, communities like Taylor, they get short shrift because of the way we allocate funds. And that's a point that I just want to leave there and to say that, of course, we're going to use these funds in the best way possible. but it is quite frustrating to be the state's biggest municipal health department and get the same slice as District Health Department number 10. No offense to District Health Department number 10. They're great. They do great work. They cover a very small proportion of the lives that we cover every day.
Hmm.
Thank you for that.
Thank
And it's an old story. The household I grew up in, and you know who my dad was.
Mhm.
Occasionally, when we have these political discussions at the dinner table with all 7 kids and mom, dad would hit the table and put forth some sort of expletive followed by outstate legislators. Some sort of, if I wasn't clear. So I have the same concern here. This funding is more likely going to come to an end depending on what the trajectory of COVID. And I don't know if the CDC is looking at these other respiratory, right? And so there may be a reason to extend some of this funding. But I'm concerned, again, about using the money for hiring people and then a couple of years from now going, well, we don't have the funding anymore. We're going to have to lay you off. So the permanent nature of how we're going to, because as you know, I'm all in favor of strengthening the health department. And even with some of the money we see coming from the state and the feds isn't enough. So are we going to be tied, any of this money tied to wages and salaries that might go away once the funding is exhausted?
Yeah, so for this particular allocation, we are, to your point, not using it for salaries and wages.
Okay.
So we are using it for one-time investments
Yeah.
to strengthen our infrastructure in the public health department, and do it in a smart way because we know it's likely not going to continue.
Yeah, but salaries is one of the things that's mentioned in here,
Yeah.
so I just wanted to.
Mhm.
Do you have like a project list? This is what we spent the money on, or we intend to spend the money on?
Yeah, so
I imagine this will involve some contracts that might have to come before the commission,
yeah.
but I want to see the overall plan. We have this money
Mhm.
to permanently strengthen our health department. And this is how we've done it specifically. You know, because we all got to tell the story out there about what the heck is going on in Wayne County. You know, strengthen our health department even before COVID was a big priority of mine, and now after COVID. So knowing what that is, so if you could provide 100,000 last year, 100,000 this year, is that how it worked?
We received about 300 and something last year.
Oh, how exciting. So we've had less than $500 million.
Mhm, yeah.
Out of the, if we have 10% out of 80 million that came to the state, that's about $8 million. And we got four and some change, 400 out of that. But if you can provide, this is what we spent it on, that would be great.
Absolutely.
Thank you. Thank you, Madam Chair.
Thank you. Do we have any idea how it's going to be spent?
So this, for this fiscal year allocation, we intend to spend it on some professional development and training and conferences for staff this year. And also use it as a invest in some communications marketing to recruit into all of these open positions that we have, especially some of our outbreak preparedness staff, our emergency preparedness staff, and work with our communications team on that piece. And then also, we're working a lot this year on a community health assessment for out Wayne County. And so we hope to complement those efforts and make that data really transparent and public facing and really a tool for our partners in the community to use to be our, you know, extended public health partners. And so try to build out some of that IT work to make that data more available externally.
Okay, thank you.
Mhm.
Any more questions? Maybe not. All right.
Move approval
you.
of this item, Madam Chair.
All right. Moved by Commissioner Colleen, supported by Commissioner Anderson. And I support it, so. All right, motion carried.
No, take the vote. We haven't formally voted.
Oh, okay.
I mean,
All right. So, all in favor?
all right.
All right. Hearing none? All right. The motion is approved.
Item 3, requesting commission approval of an intergovernmental agreement with Wayne State University Center for Behavioral Health to deploy, refill, and service 100 naloxone vending machines across the county.
Okay. Thank you. I'm looking forward to hearing about this. I think this is new. All right. Thank you. Go ahead, Dr. Assad.
Yep, Dr. Abdul Sayed, Director Health Officer, Wayne County. So this is a really extremely exciting project, and it would offer the opportunity for Wayne County to be a national leader when it comes to the municipal deployment of life-saving naloxone. As you all well know, naloxone is a medication that can reverse an opioid overdose within a matter of seconds. Having naloxone is the difference between somebody living and somebody potentially dying. We are facing, like the rest of the country, a fentanyl crisis, fentanyl being an extremely potent form of opioids that can be manufactured at a very low rate. It is easy to transport, and for that reason is being used to cut all kinds of street drugs. And so these vending machines offer us an opportunity not just to deploy life-saving naloxone, but also to deploy things like testing strips for fentanyl and xylazine, so people can know whether or not their supply has been laced with something that could kill them in very low potency. Really excited to be working with really the best in the business, the Center for Behavioral Justice and Health at Wayne State University. And we have our partner in the work, Professor Matt Larson from Wayne State, who can speak a little bit more on it. But this is an opportunity for us to take the wisdom that they've learned about where to place these, about how to place them, the experience that they've had placing them and supporting them, and to do that many fold over. 100 Narcan vending machines means that we are going to be putting these all over our communities. And every single dose of naloxone that's vended out of that machine is a dose that could potentially save a life. So when we think about what it takes to take on the opioid crisis, this is a really important first step, but it's not the only step. Over the course of the next year, you're going to be hearing a lot more about some of the projects that we intend to roll out in addition to this one. So when you think about the approach to taking on opioids, it's really three parts. It is prevention, making sure that folks never fall prey in the first place. Treatment, getting treatment for folks who suffer the disease of substance use. And then it is harm reduction, so that when folks are using, the probability of either dying of an overdose or contracting a viral illness is reduced. And we're working on all three fronts. So we don't want you to leave this conversation feeling like this is once and done. This is the first tip of a very long spear to try and take on this challenge in our communities, in part supported by the opioid funding from the litigation. So with that, I'll hand it over to Matt just to say a few words about their work, and we'll look forward to your questions.
Thank you. Dr. Larson?
There we go. Good afternoon, Commissioners. Dr. Matt Larson, Wayne State University Center for Behavioral Health and Justice. My role there is Director of Implementation, and I oversee the implementation of all of our programming throughout the state, most of which involves county partners. This is one of the programs that we're especially excited about. As you all may know, Wayne County has an overdose rate that's about 2.5 times the state average. And so this program and intervention, we think, will go a very long way and help reduce those numbers and save lives. And in the end, this is a life-saving program. All right. Dr. Elsa just referred to the life-saving measure or reach of naloxone and testing strips. And our role in bringing that program to life is going to be to identify the communities most in need through an evidence-based approach. So looking at law enforcement data, fatal and non-fatal overdose data, to determine where exactly these machines should be placed so that they have the broadest reach and are most effective. This will represent the largest by a long shot program in the country to date. And so we're really excited about the potential of it.
So do you have any idea on where to get started?
Yeah, we've already received data from our friends at Wayne County, and so our team is starting to review that. As it stands, we're going to start with the placement of one machine in each of the 43 communities in Wayne County. And from there, we'll employ the evidence-based approach to identifying the remaining 57 locations. In that process, we're going to connect with community organizations who have long been doing this work, harm reduction work. They've been on the streets for a long time and know a lot about what's happening beyond what the data shows. And so incorporating the data-driven approach with the community voices that have been involved in this work, we know that identifying those 57 locations is well within reach.
Thank you. Commissioner Anderson?
Thank you, Madam Chair. Just a quick question, where those initial machines are going to be located? I mean, I understand you're taking those, and then from that point forward, you're going to use data that's provided to you by police departments and others, medical personnel and that. But anyway, if you could, I guess that's what I'm interested in. When I first heard about this, I was a little concerned about, okay, what's going to happen with these doses of the preventative to prevent the loss of lives. I thought it was a great idea, but then I started thinking about what's going to happen that we would not want to think about is going to happen. People going and taking those out. Maybe someone well-intentioned that says, if I can take 5 or 10 of these and have them on hand, I'll pass them around. And then maybe someone that knows someone that's using that needs that, it's not there. So what do we do to prevent that?
Let me jump in. So the first point is we want people to have more, right? And, I think there's this worry that somehow if somebody abuses and takes too much of this, that there wouldn't be enough for everyone else. The good news is that the state actually provides this for free and will be replenishing on a regular basis. So it's not going to be the situation where the vending machine just kind of runs out and there's not enough for people who need it, right? It's going to be the situation where, fine, you want to take 10? That's fine. Take 10, right? We'll give 10 more, right? It's okay. At the end of the day, we want more of this out there, not less. Mm-hmm. And the mindset for us has to be one of the more that we saturate the community, the environment with naloxone, the better off it is. Right. And so, you could be in a situation where you're out partying one night and you may not even be a user, but if you've got this on you and you know that somebody might be overdosing in the bathroom, you potentially could be someone who saves a life. And the challenge with the way we've thought about naloxone over the past decade has often been that we put it behind some government enterprise, whether it was a firefighter or a police officer. And too often those folks aren't the people who are there when people are using. People don't tend to use when they know that a police officer is in the vicinity, right? And so waiting for a police officer when we know that an overdose death can happen within a matter of minutes, that is just not the point. So our goal here really is to get it out everywhere, right? And the way that we're thinking about our partnership together is such that we can replenish our stock, so you're not in a situation where things are running out. To your first question about where do you put them, one of the advantages of working with Wayne State is that they don't code as government, right? They code as a neutral third party who's been focusing on this work and doing this work for a long time. And so they've got really, really great relationships with everybody from government, municipal centers. So if you want to put it at the local public library, great. Or they've got relationships with some of the folks in the community who know where folks who may benefit from this are most likely to be and to access this. And so we actually see it as a real benefit in seconding the responsibility of placement to them, because we know they can be evidence-based, we know they can be trusted, and we know they have relationships that they can leverage in the process.
So you're telling me that the machines, as soon as they run out, there's going to be someone ready to jump into action and fill them again within minutes, hours, days?
I mean, unless there's like some Narcan bandit out there who just wants to empty the machines,
Yeah.
we're not really all that worried about it. I think the novelty of emptying the machine probably fades after the first time you do it. So
Could be. I know people try to profit from things that ridiculous things that'll harm the public health too.
Yeah.
So, but anyway, that was a concern I have, how if it's going to reach the folks that are in maybe doing something that is going to endanger their life. And I believe that it's absolutely a well-intentioned. I just hope it works out the way you think.
So, Professor Larson, do you want to speak to the experience you've had in some of the vending machines that you've already deployed?
Yeah, I was going to comment. So we have already placed over 30 machines throughout the state. Our partners include MDHHS as well as the Michigan Department of Corrections. And the question that you raise about access and whether or not people are going to be taking more than they need is something that our partners have inquired about too. But thus far, the experience hasn't been a problematic one whatsoever. And in the case where a lot of the naloxone is being used, we have a relationship with these 100 naloxone vending machines as we move forward. I don't know about minutes, but certainly days, not too many days for the replacement of those kits.
Thank you both so much. Commissioner Killeen?
Thank you, Madam Chair. Dr. El-Sayed, I'm going to play follow the money here for a minute. If I heard you right, we're going to use proceeds from opioid litigation to pay for this program. And so the 3.7 million referred to in here, is that out of the opioid settlement?
It's a blended fund, part mainly opioid and part ARPA.
And part ARPA.
Post ARPA. We don't actually have ARPA funds, right?
Right, but then it'll be opioid litigation. Now, we've had 2 settlements in Wayne County so far on opioid. And I think there's still a few cases out there.
So we've had, I think there have been 4, but where we've actually received funding, I think is from 2.
Yeah.
So it's, the actually management of the opioid settlement dollars is actually quite complicated.
Yeah.
Because you're talking about multiple different settlements, all of which have somewhat very similar, but somewhat different stipulations about use.
Right.
And so we're trying to be the best possible stewards of that funding that we can. But we see this as being exactly the kind of project that those settlement funds were intended to be used for.
Because it's up to the judge in the court order to say what this money can be.
Not quite. It's up to our responsibility is to get a legal assessment from our corp counsel.
Oh, okay.
And our corporate counsel, of course, this is a bit of a slam dunk. So
Right.
we have that in place now. In theory, that could go before the court, but given that we have a solid legal opinion that this sits within the frame, it's unlikely to be challenged.
And do you have any sense at all of how long this will be sustainable? Because the opioid lawsuit money is not going to go forever.
No, but it is going to go for 18 years.
18.
Yeah. So
Okay, beautiful.
we see this as being sustainable for quite a while.
Okay.
And remember, the biggest expense, if you look at the structure of the contract, is up front. It's actually buying the vending machines and placing them. Once they're placed, right, the cost of sustaining the program actually gets quite small.
Yeah, well, you have to load in the machine.
Exactly.
Okay.
It's just making
No,
sure that
this,
you replenish
this is fantastic. And Dr. Larson, we got a paradox down there. Paradox, how about that? I can draw you the organic molecule, show you paradox. No, doctor, I was not aware that Wayne County was 2.5 times the state. You kind of threw that out like, yeah, of course you guys know this. No, I don't. Have you worked with DeWin on this at all? Detroit Wayne Integrated Health Network?
We have not to date, but we're actively work with DWIN on a variety of other partnerships. And so this is certainly something that we will keep them apprised on as we move forward and make some of the important decisions that need to be made.
And
Because I think over at DeWin, we were the first at DeWin to start with Noxaline. Do all police departments in Wayne County have this now for their officers when they're out on patrol? So the cops are all covered in having this. And so I think this is a good step forward to make it available in other ways. And 100 machines is not going to be the final number. If we have 18 years of funding coming, and we'll see what happens with some of the other lawsuits. But, 100 machines can disappear in a hurry in this county. So hopefully, is it part of the plan to?
we'll be working with, when we place them, there will be a level of security that assures that they're not just going to, the machines are not to be taken, but we do have funding
That's not what I'm
available.
worried about. I'm not concerned about that.
You mean the vandalism?
No, I just mean, is part of the plan and we're getting money in from the opiate lawsuits. And so by 2026, we want to have 200 of these machines out there. Is that kind of how it's?
So we want to start at 100 and then
Yeah.
from there see what is the use and is there a need for more, right? And we want to be really quite evidence driven. Now, we've structured things such that we could expand the number of vending machines. I do want to be clear, this would be by an order of magnitude, the single biggest municipal investment in naloxone access in the country's history, by like an order of magnitude. And so Wayne County will be the place where it's easiest in the country to get naloxone. And we want to keep it that way.
Absolutely. All right. Thank you. Thank you, Madam Chair.
Thank you, Commissioner. Now, there was some training that they had to give before. Is there training for this?
Yeah, so we will develop a pretty specific protocol for all of our partners so that they have answers to any questions that arise with the placement of their machines, as has been the case with our existing partnerships throughout the state. Absolutely, yeah. And we will also include informational packets for folks on how to use naloxone, as well as the testing strips.
And the contract also includes an investment in a marketing strategy to get information out into the community about how to identify an overdose, how to use naloxone, where to access naloxone, so the general public understands how to do those things.
Very good. All right.
Madam Chair,
Thank you so much.
just real quick,
Commissioner
the WIN
Blaine.
might have a number for like how many lives have been saved in Wayne County, especially through the use of the officers. I mean, when we first started this, we would have these little, at our annual meeting, we'd bring 7 or 8 police officers from different departments that had used, this is right at the very beginning, right? And we're like, yeah, 10 lives saved this year. But since this has grown and the work you're, and other people are doing, if we have a number, which would be good to share with the public, how many lives are saved because of naloxone? That would be, not now, but that'd be a good number to have, unless you have it at the top of your head.
No, I don't. And I think that's a great point.
But I think
Absolutely.
it's, yeah. Thank you. Thank you, Madam Chair.
Thank you so
Appreciate
much,
that.
Colleen. All right. Any further questions? All right. Thank you both so much.
Thank you.
Being
You're
here.
Item for approval, Madam Chair.
It's been moved by Commissioner Colleen. Is there support by Commissioner Anderson? And I support it. So all in favor? Right. Any opposed? Hearing none, motion is carried. Next item, please.
F, such other matters as may be properly submitted before the committee.
I don't know of any. So next item.
G, public comments.
Is there anyone on the Zoom or on the phone wishing to speak to this committee? Is there anyone? Hearing none, is there anyone in the audience that wish to make a statement or ask some questions? Hearing none. Thank you. Next item, please.
Adjournment.
Move to adjourn.
Move adjournment, Madam Chair.
All right, it's been moved and supported. All in favor?
Aye.
We